If those cost-sharing subsidies are funded next year, Blue Cross of North Carolina says it will still need to raise rates, but only about 8.5%, not 20%. Lawmakers are back in their districts this week, but as Senate Republicans work on their version of the health care bill, there's one issue that looms large: what will happen to the expanded Medicaid program for low-income Americans? And as Kayla Tausche reports, that debate is playing out in Little Rock, Arkansas.
George Coleman drives a cab for a living, but struggled to pay for health care as his asthma worsened and the cost of his medication got higher.
One of the inhalers can range from anywhere from $400 to $600 a month.
Coleman is one of 330,000 Arkansans whose incomes made them newly eligible under the state's expanded Medicaid program.
I truly have been born to believe that you work for what you get. And you whatever it is that I get, I want to earn it. But this is something that is beyond probably my means.
Governor Asa Hutchinson says the popularity has made the program too costly to maintain.
We estimated 250,000 that would go on the expansion, and that soared to 330,000.
This month, the state moved to pare it back, adjusting the qualifying income levels to reduce enrollment by 60,000 people.
We're curtailing those numbers as a cost-saving measure, and it's not an easy thing to do. I think we've laid the groundwork here for reform in Arkansas that will be sustainable over the long term under the status quo.
For Arkansas hospitals, the status quo works. Here at the University of Arkansas for Medical Sciences, the number of uninsured patients fell 80%. The clinic turned a profit and hired more than 1,000 people. What's more, the state as a whole saw no hospital closures. But with looming cuts to these healthcare programs, Dr. Dan Ron says that stability and growth is at risk.
We're being very careful about long-term capital investments. No community can experience economic development in the future if it does not have sufficient healthcare resources in that community.
Medicaid expansion is dividing Senate Republicans as they draft a new bill, pitting lawmakers from states like Arkansas that expanded coverage against those who didn't. President Trump tweeting today, Republican senators, whom he called good people, should pass their proposal quickly. Arkansas is trying to make its program last either way. For Nightly Business Report, I'm Kayla Tausche, Little Rock, Arkansas.